perform hand hygiene for 20 seconds. Hi, I'm Christian. I'll be your nurse for today. Can I have your name and date of birth? Alright, Ana Louis Dollars, and your birth date is June 11, 1998. Just give me one moment and then I'll check your wristband. Okay, everything matches up. Do you have any allergies I should be aware of, such as chlorhexidine or iodine? Okay, and have you been experiencing any pain or discomfort recently? Some discomfort because of the urinary retention? Alright, well your doctor has ordered a urinary catheter to be placed for you because of your trouble and your discomfort urinating. Have you had this procedure done before? No? Well, I'm happy to explain. So first I'll be lifting up your gown so that I can clean around your perineal area. I will then insert the catheter into your urethra and then into your bladder. I will then inflate the balloon that is attached alongside the catheter tubing so that it remains in place in your bladder so that you're able to move around freely. I will finish off the procedure by attaching the catheter to a stabilization device on your upper thigh so that when you get up, it does not move around. The urinary catheter will remove the urine from your bladder and it will empty into a drainage bag at the bottom of your bed. Do you have any questions or concerns before I begin? Okay, perfect. So now I'm just going to give you an extra blanket so that you remain comfortable during the procedure. Going to perform hand hygiene for 20 seconds. So just give me one moment, Mrs. Hidalgo. I'm just going to wipe down my table. I'm going to be wiping it for 30 seconds, making sure to let it air dry for 2 minutes. How's your day been, Mrs. Hidalgo? Oh, I'm glad to hear you're excited for your pregnancy. Yeah, becoming a parent is a life-changing experience, but I like to believe it's rewarding at the end of the day. So I'm excited for you as well. Also going to make sure to clean around the edges of the table. Okay. Going to perform hand hygiene for 20 seconds. So you're required to be laying flat or in supine position, which you already are, so I'm going to close your door and then close your curtain to maintain your privacy. I'm going to perform hand hygiene for 20 seconds. Now that my table has dried, I'm going to bring in my supplies. I have my 10 milliliter syringe, my alcohol prep pad, my stabilization device, and an extra set of sterile gloves, and then my Foley catheter kit. Alright, and now I'm going to perform hand hygiene for 20 seconds. And in just one moment, I'm going to remove your gown and clean your perineal area. I'm just going to lower your blanket, and then I'm going to put your legs in a frog-like position because you're required to stay in this position until I'm done with the procedure. And then I'm going to lift your gown. Going to make sure to clean the sides. And then clean down the bottom or down the middle. Oh, I'm going to move your gown down before I remove my gloves. And I'm going to perform hand hygiene for 20 seconds. Now I'm going to open up my kit. I'm going to dispose of this. I'm going to perform hand hygiene for 20 seconds. Then I'm going to lift your gown once again. I'm going to perform hand hygiene for 20 seconds. Then I am going to place the sterile drape in between your legs. Okay, perfect. I'm going to perform hand hygiene for 20 seconds. Going to drop in my materials. I'm going to perform hand hygiene for 20 seconds. And then put on my sterile gloves. I'm going to release the cuff on my dominant hand. Okay. Going to open the specimen cup just a little bit. Okay, I'm now going to move my materials in between your legs. And then I'm going to just clean your labia one more time. I apologize, it may feel cold. And one more down the middle. Okay. So now I'm going to insert the catheter. I'm going to count to 3, and then I want you to take a deep breath. I'm going to count to 3 and insert it. So 1, 2, 3. I see urine, so I'm going to insert it. Advance it another 1 or 2 inches. Alright. Going to inflate the balloon. And I'm just going to give it a tug. I feel some resistance, so it is securing your bladder. So how's that for you, Mrs. Idadas? Any pain? Alright, perfect. Just going to lower down your gown. And now I'm just going to collect a sample of urine. I'm going to scrub this port for 15 seconds. Making sure to let it air dry for 15 seconds as well. Alright, I'm going to collect at least 5 milliliters of urine. Okay. I'm now going to prep your upper thigh so that I can place the catheter onto the stabilization device. Alright. I'm just going to place it on your thigh and then put the drainage bag at the bottom of your bed on an immovable portion, and then so that gravity can help the urine drain down. Okay, how was that for you, Mrs. Idadas? Any pain or any discomfort? Okay, perfect. I'm just going to throw away some of my materials. And then I'm also going to put your legs in back in normal position and put your blanket. Alright, going to remove my gloves, perform hand hygiene for 20 seconds. Going to open the urine. Going to put the sample of urine into the specimen cup, making sure not to touch the cup or make any splashes. And then this will go to the lab. Alright, do you have any questions or concerns before I leave, Mrs. Idadas? Okay, perfect. I'm going to put 2 to 3 side rails up, your bed in the lowest position, your cobweb within reach, and I'm going to sit you back up. I thank you. I'm going to make sure to label the specimen cup with the patient's name, the medical record number, the date and time of the procedure. I'm going to perform hand hygiene for 20 seconds, and I'm going to document the date and time of the procedure, The patient tolerated it well. The catheter size used was 15, and the urine observed was 400 milliliters, clear and yellow. Thank you.